I found this interesting research paper which talked about a 42-day yoga challenge for hypertension. And the yoga protocol was starting from asanas to pranayama and relaxation. The total time for this entire protocol was around 60 minutes. And this has to be done for 42 days. And the study suggests that there has been a drastic improvement in the participants as regards to hypertension. And if you look at the protocol, it starts with asana. It starts with Tadasana, which was done 3 times, Paschimottanasana 3 times, Mandukasana 3 times, Padmasana for around 1 to 2 minutes, followed by 1 round of Surya Namaskar. After the asanas, the next group of yogic exercise was pranayam. They looked at Bastrika for 2 minutes, Kapalbhati for 10 minutes, Nulum Vilom for 10, Brahmari and for 15 times, Udgit Pranayam or Omkar chanting was done for 11 to 15 minutes. This was followed by Shavasana. The protocol talks about either you start with asana, then go for the Shavasana, and then subsequently finish it off with pranayama. And this sequence, usually in sequence, you start with asana, and then since the breath is higher, after Surya Namaskar, we go for a Shavasana, and then followed by the pranayama. And this was done for around 42 days to see the impact. Now let us talk about the study design, what was done. In this was a clinical trial, 86 hypertensive individuals and around age of 30 to 60 years. They were divided into 2 groups. So we call it as experimental group and the control group. In experimental group, there were 39. In the control group, there were around 47 participants. And in the experimental group was given this protocol for 42 days. Pranayama, asana, and relaxation, which consists of 60 minutes. In the control group, there was no intervention given. And since they were hypertensive individuals, both groups continued with usual medication. So the usual medication for the hypertensive individuals were continued for the both group. And they wanted to test the difference between the experimental and the control group on various outcome measures. And this was a 42-day integrated yoga program. And then when the study was looked into, sorry, for my first screen, the outcome measures which were looked into were the physical parameters like weight, the BMI, the body surface area, systolic blood pressure, and the DBP, which is the diastolic blood pressure. And in terms of oxidative stress parameters, it looked at GST, MDA, and FRAP, where GST was measured by the enzyme activity, and MDA and ferric reducing ability of plasma indicated the amount of oxidation in oxidative stresses in the blood parameter. And after a 42-day intervention, the group showed up various results. In terms of physical parameters, it showed a significant reduction in BMI, BSA, SBP, and DBP. This indicates that the BP parameters had come down compared to the experimental group and the control group. Experimental group had a reduction in BMI, BSA, SBP, and DBP. The body weight did not show any changes in both the categories. This indicates that there was no drastic reduction in the body weight of both these groups. In terms of oxidative stress parameters, there was a significant increase in GST activity, indicating that the antioxidant enzyme has increased. And there was a significant decrease in MDA levels, indicating the marker of oxidative stress has been brought down. And a significant increase was also noted in FRAP, indicating the improved overall antioxidant capacity. And there was none of the adverse event reported in this study. So the study concluded that a 42-day yoga regimen, along with the conventional therapy, which was being done in both the groups, it improved the control of blood pressure and it reduced the oxidative stress in the hypertensive patients. And also it looked at that both the individual's genetic makeup or GGST polymorphism might influence their response to yoga therapy, highlighting a potential area for personalized treatment approaches. So this study brought in this particular suggestions as regards to how a protocol can bring down the markers of both oxidative stress as well as improve the blood pressure control responses using the conventional medicines. And in terms of quality assessment, it is assessed using the Pedro scale, and it is indicating a score of 4 out of 10, indicating the moderate methodological quality. Of course, it's not 10 out of 10. It's not a double-blind controlled trial, but rather we would say that this is a indicative that the yoga protocol works. Now, if you look at the protocol once more, what is being looked at is in terms of asana, Tadasana, Paschimottanasana, Mandukasana, Padmasana, and the Surya Namaskar was done for one time, followed by the pranayam in terms of Bastrika, Kapalbhati, Anulom Vilom, Ramri, Udgit, or Omkar chanting. And both were followed or intermittently by Shavasana for 10 minutes. And this study marks an important landmark in the yoga protocol, or how yoga could be used as a complementary therapy in both, along with the conventional